In today's video, we're going to be talking about the top 10 Invisalign myths. Invisalign is an appliance which is used to move your teeth, and the technology has been around for 20 years. There are a lot of myths surrounding Invisalign treatment, so we're going to talk about them in today's video. So the first Invisalign myth is that Invisalign doesn't work as well as metal braces. The principle of moving teeth is slow, continuous pressure over a long period of time. Metal braces involve fixed brackets which are stuck onto your teeth, and then a wire is applied, and this over time can shift your teeth into the correct position. Invisalign is like an acrylic shell which is placed over your teeth. With the same continuous slow pressure, your teeth are moved into the correct position. So there's no difference based on the effectiveness of both techniques. Invisalign works just as well as metal braces. The second Invisalign myth is Invisalign takes longer to work than metal braces. This isn't true because it all depends on your teeth position before you start orthodontic treatment. Depending on the severity of how your teeth are positioned, it may take longer than a traditional case. However, there's no difference between the length of time whether you're using metal braces or Invisalign. The third Invisalign myth is that Invisalign stains. Now, the trays used for Invisalign are made from a clear acrylic, and if you eat lots of staining foods like curry, chocolate, if you smoke, then your tray is more likely to get stained. However, with Invisalign, you only tend to wear each tray for about a week or two at a time, and then you change onto a new tray. So in that short amount of time, it's not likely for your tray to stain, especially if you're being extra careful with the foods that you eat, and if you're keeping up a good oral hygiene routine. You can also take out your Invisalign trays briefly just when you're eating as well, and that can reduce the risk. The next common myth about Invisalign is that it's just for younger patients. Invisalign can actually be used at any age. Orthodontic treatment in general is better to be started at a younger age. Regardless of your age, you're still eligible to have Invisalign treatment. The fifth myth we're going to talk about is that Invisalign is the same as those mail order aligners which you've seen advertised. Now, there is a big difference between Invisalign and those mail order aligners. The first thing is Invisalign allows for more complex tooth movement. That's because your case is going to be reviewed regularly by a dentist, and they can always make adjustments as you go. They also do a checkup and check your overall dental health prior to you starting any treatment. The teeth movements that you can make with mail order aligners are a lot more limited, and it is a lot more riskier to do because in some cases you can start treatment without a full mouth assessment. The next Invisalign myth we're going to talk about is that it may give you a lisp. Now, when you're wearing an appliance in your mouth for 22 hours of the day, initially it may feel a little bit uncomfortable, and when you're talking, your tongue may catch the trays and it may come across as though you have a lisp. This is only true in the beginning because you're not used to the aligners in your mouth. However, the longer you're wearing the aligners, the more you're talking and getting used to them, the faster you can overcome this lisp, and it usually goes away after a few days. The seventh Invisalign myth we're going to talk about is some say that you can't make certain teeth movements with Invisalign. I would say this was more true in the past, however now, the types of teeth movement you can do with Invisalign is far more complex than before. You may be able to have attachments or buttons which are placed onto your teeth, and this can help facilitate more complex teeth movements to get your teeth in the desired position they need to be. The eighth Invisalign myth is that Invisalign is expensive. Now, this is entirely dependent on your teeth situation. If you have a complex case, then it may require more trays of Invisalign, and it may require a longer time. And this could cost more over time. However, if you only have a small problem with your teeth, then you may just need fewer Invisalign trays, so your cost of treatment would be a lot lower. The ninth Invisalign myth is that Invisalign is painful. Again, in the beginning stage of any orthodontic treatment, when you are moving teeth around, teeth may become sensitive, they may become painful when biting, but this is only true in the initial stages. Once you get used to wearing your tray, and if you're extra careful having soft foods, avoiding clenching your teeth, and wearing your Invisalign trays for the duration that you're supposed to be wearing them, then pain is minimal. You may experience some slight discomfort initially when you first put the tray in, or when you switch to a new tray. That goes away very shortly afterwards. The last Invisalign myth is that Invisalign is more likely to relapse. Now, this isn't the case because with any tooth movement, whether you use Invisalign, whether you use metal braces, there is that risk of relapse of treatment. The teeth could always move back to their original position. You can reduce the risk of this happening by having a fixed retainer bonded onto the back of your teeth, and that can prevent your teeth from moving back. It's also recommended to have a removable retainer which you wear at night time, and this is expected to be worn for the rest of your life. And those two steps should be done whether you're using Invisalign or if you're using metal braces. So we've made it to the end of the video. If you've made it all the way to the end, leave a 100 emoji so I know you've made it to the end. If you have any questions, leave a comment below. Make sure you like, comment and subscribe, and thank you for watching.